according to the guidelines, what do they offer clinicians in terms of determining when intermittent claudicants, these intermittent claudicants that you would fit into the category for conservative therapy, lifestyle modifications, walking, medicine, etc., when they should be allowed an intervention? For example, if they can't reap the benefits of a cardiac rehab program for their heart because they keep having to stop and rest every few minutes.
So the guidelines give a class one recommendation to patients that have failed exercise therapy and medical therapy for P.A.D, for claudication, and for revascularization. And actually, they give a higher recommendation to endovascular revascularization than bypass. They give a class 1 for endovascular, and they give a class 2A for bypass, because bypass is more invasive. So for claudication, the guidelines actually are more friendlier to endovascular approach because it's less invasive, and because of that, it's a friendlier recommendation for endovascular. But again, we want to make sure that we are doing everything first, right? Going back to your point, if you're smoking 2 packs a day and you are not doing any exercise and your LDL is 180 and your blood pressure is 170, is the stent going to help you? No. And I mean, let's be honest, it's not going to help. And the stent is going to close. And you're going to get it, and then people say endovascular doesn't work, but that's not true. So the bottom line is that we need to get our patients optimized with all the things we just talked about for the past hour. And then if the patient still has symptoms, we want to relieve those symptoms because we want our patients to walk. We want them to be able to be effective members of the community. We want them to be able to do their jobs and take their dogs out for a walk and chase their grandchildren and do the things that they want to do. But we have to do both. We have to do the risk factor modification, address the exercise component that we just talked about, and then, if necessary, we can offer endovascularization.
So you say that they're weighing a little bit more heavily towards endovascular, especially for the earlier stage, and probably mainly considered lifestyle limiting claudicants.
That's right.
But what are the indications for intervention versus bypass for beyond? Because we still have a good portion, a lot of patients that are offered bypasses, frontline therapy beyond conservative approaches. So if walking feels conservative, they never even go in. And I always say to patients, well, wouldn't you want someone to at least go in with a wire and balloon, pump in the contrast fluid? And I even say my non-negotiable is the use of intravascular ultrasound to really get a better idea of the morphology of the plaque, because sometimes I've seen like a CT angiogram can have some limitations in certain areas where it looks as though you can't get through. It looks as though there's this really tough blockage. And then you go in and it's just mush. You get through the cap and then they poke the wire right through and go right through this 100% blockage. Absolutely no problem.
Yes.
So I get concerned when when I see patients and I say, hey, you might want to just get a second opinion before going straight to an invasive procedure, especially if you're a patient with comorbidities such as diabetes.
Well, Kim, I think you are speaking of something that's very important. I think in healthcare, we take the recommendations for granted and take it at the face value. When you want to, I tell my friends and my patients all the time. So when you want to buy a car, you never just walk to a dealership and the first car that you see, you just buy it. Let's be honest. You're going to do some search. You're going to talk to a couple of friends. You may go to a few dealerships. You're going to look at the blue book, the green book, I don't know what books they have these days. But anyway, you're going to do you do your homework. Now you talk about your body. So you should always ask for a second opinion, especially if it's something that's bothering you, that you're suffering from, or if you're going to lose your leg, for God's sake. So I am very passionate about second opinions when it comes to healthcare, and even third opinions to get all the facts and then make a educated decision yourself. Make a shared decision making, we call it, so that you have all the information and you know what all the options are, and you can make a educated, knowledgeable decision in regards to how you want to proceed. So I think you're hitting that on that. I mean, it's hard to make general statements. There are some situations that surgery may be better. But I agree with you that unfortunately, a lot of time it depends. There is a lot of heterogeneity of care. So if you come to me because I don't do surgery, you may get endovascular. If you go to somebody else that doesn't do endovascular, you may get surgery. And it shouldn't be like that. It should be that, somebody discusses all the options with you, and then you make a decision. You say, you know what, maybe doing it with wires and balloons is a little bit less riskier, is a good first step. As long as the doctor is knowledgeable and knows what they're doing, maybe I want to try this first. Now, if that doesn't work, maybe that bypass can be a second option because that's a little bit more invasive. And I think that's what the guidelines are saying. The guidelines are saying that endo is a little bit more invasive. Maybe that's a better first option for claudication. And then if that doesn't work, then we can consider surgery as a 2A. But just because the guideline says it's one, it doesn't mean that all endovascular is created equal, right? So it's just that you need to find the right doctor, someone that has a good understanding, somebody that has a high quality, and that you have vetted and make sure that you have gotten a second or third opinion in regards to that what's going to be done is going to be done correctly and effectively for you.
I think that that's so important.